Hi everyone and welcome. Just like to welcome you all to this webinar on the value of embedding preceptorship for new P&O graduates. My name is Aoife Healy. I'm the Education and Practice Development Officer at BAPO, along with Krista here, who's also on the education team at BAPO. And I'm just going to introduce Dr. Joe Watson, who's going to be leading the webinar. Joe is currently leading the 2024-25 preceptorship work stream for BAPO on behalf of the Creative Health Alliance, and this is part of the wider NHSE projects that BAPO is involved in. Jo has been working with BAPO previously, and she was the co-author on the recently published BAPO Early Career Guidance Framework. So Jo is going to be presenting to us today on her work throughout this project so far. There's going to be a presentation, and then at the end there'll be time for questions. So I just ask you all to keep muted for now. If you want to ask your questions, if something comes up during it, you can put the questions in the chat, and we'll also have an option to get you to unmute and ask questions at the end. Thank you very much. So I'll pass you over to Jo.
Thank you very much, Aoife, and good evening, everyone. Thank you so much for joining us. It'd be really great to know who's in the room with us this evening. So perhaps I'll ask you if you wouldn't mind introducing yourselves to each other, just so that we get a sense of who's here with us this evening. So the aims of the session this evening are broadly organised into three themes. One is around understanding what preceptorship is, and importantly, what it's not. Key factors to consider when establishing or when enhancing preceptorship offers, and the impact and ripple effects of preceptorship on crucial factors that are going to be of importance to every employer, whether they're located within statutory service provision or the independent sector. A key point of reference, as Aoife mentioned a moment ago, is going to be the BAPO Early Career Guidance Framework, which was published earlier this year. It's open access, so anybody can get hold of that one. I've put the URL and a QR code on the slide there for you if you'd like to have a look at that as we go along. So let's start the session by defining preceptorship. So preceptorship is a period of individually tailored, structured support that's provided to healthcare professionals, in this case to prosthetist-orthotists, during key moments of career transition. For the time being, our focus is on that transition from pre-registration learner to HCPC registrant, commencing their first role as a registered professional. But it's also relevant at other transition points during careers, such as when people are returning to practice after a lengthy break, for internationally educated practitioners beginning work in the UK for the first time, or when transitioning to new work settings or sectors. The purpose of preceptorship is to improve an individual's confidence as they move into a new role. So it's allowing them to apply and develop their knowledge and skills to best effect within their scope of practice, and then go on to achieve their individual potential. If you've already had the opportunity to look at the Early Career Guidance Framework, you'll know that it aligns with and it's informed by the HCPC principles for preceptorship and the AHP preceptorship standards and framework that was published by NHS England. So these will also be really valuable resources for you to have a look at. Before we go on to unpick that definition of preceptorship a little bit further, I'd like to focus on why it's so important and why so much time and money and effort has been invested nationally and across all non-medical disciplines to establish preceptorship as a normal practice for all employers. And we're obviously going to do that through the lens of the P&O profession. So we already know prosthetics and orthotics is a small but mighty profession. There are fewer than 1,200 on the HCPC register at their May 2024 snapshot. And that makes P&O the smallest of all of the UK allied health professions. An HCPC report in 2023 identified that 1 in 8, so that's about 12.5% of prosthetist orthotists, leave the register within 4 years of first entering it. That's the lowest retention rate over that same period of time across all of the AHPs registered by the Healthcare Professions Council. That's a really significant level of early attrition from a very small profession, and is clearly, grounds for considerable concern. That's particularly the case when indications are that workforce numbers already fall behind World Health Organization recommendations in relation to population size. And then, to make matters worse, in the recent National Workforce Survey, only 34% of respondents definitely planned to stay in the profession for the next 5 years. So low levels of job satisfaction, concerns regarding lack of career progression, workload and lifestyle balance, caseload volume, and not feeling valued as a member of the team were identified as amongst the leading reasons for people thinking of leaving the profession. At the same time, we've got changing UK population demographics and health needs, which suggests that a growing number of people will be requiring prosthetic and or orthotic care in the years ahead. So the result of all of that is that we have a shortfall in the P&O workforce required to meet current and projected demand. So clearly something's got to change. This is a major sustainability issue that affects everybody on the call. Equally clearly, there's not going to be one single magic solution to what is a really complicated problem, but preceptorship can be a part of the solution. We know that there can be a lot going on in the early weeks and months of a new graduate commencing their first registered post. Each of the activities has a role, and these roles vary. So it's really important to try to be clear about what those roles are and how they may or may not intersect. So let's go back to that definition of preceptorship and consider that against some of the others. As a reminder, preceptorship is that period of individually tailored, structured support that's provided to prosthetists and orthotists during key moments of career transition. And in the context of our discussion this evening, we're focusing on that transition from pre-registration learner to their first clinical role as an HCPC registrant. As we noted earlier, the purpose of preceptorship is to improve confidence. That's a really important point as individuals move into their new roles. It supports them to apply and to develop their knowledge and skills, and it supports them to achieve their potential. And in doing that, preceptorship supports recruitment, integration, and retention of staff, and that in turn supports workforce sustainability and the quality of services, and it enhances the outcomes and experiences of the people who are accessing those services. If we turn to induction or onboarding programs, they obviously have a really key role in supporting new employees to become established in their new position, in their place of work, and within their service. And an onboarding program would typically include things like getting to know who they'll be working with, becoming familiar with new surroundings, being introduced to health and safety procedures, including undertaking statutory mandatory training, introducing relevant organisational policies and procedures, clarifying their key roles, their responsibilities, your expectations of them, and how their work fits into wider service delivery. There might be discussions about probationary arrangements and also identifying training needs. So depending on the organisational context, it might also be a period in which new graduates are entered into, registered for, organised so that they can join a preceptorship program and allocated a preceptor. Equally, it might be appropriate to incorporate induction into preceptorship offers for new registrants in different contexts. So that there's no one right way of doing it. Generally speaking, graduate training schemes or programs tend to be more skills and knowledge based. So from the discussions that I've had with colleagues across the P&O profession, they often seem to be focused on training that's relevant to a graduate's first role. So that might include things such as using the preferred IT tool for patient record keeping. It might be around footwear, biomechanics, casting, product and component knowledge, measuring for compression garments, recording measurements and other technical requirements of ordering products, and so on. When it comes to supervision, the HCPC identifies that although there's no single or agreed definition, it's fundamentally a process of professional learning and development that enables people to reflect on and develop their knowledge and skills and their competence through an agreed and regular support process with another professional. It can have different forms and functions, and it can be described in a number of different ways. So, for example, clinical supervision is identified as aiming to support learning and develop competency related to specific clinical tasks. Professional supervision is suggested to focus more broadly on identifying CPD needs. And then we've got this operational and line management supervision. So it's essentially part of a CPD for all practitioners. It's really important and an expectation to support ongoing professional development and to optimise the quality of care. It benefits professionals at all levels of their career. And it gives them a chance to just really think about where something's gone well, where it's not gone so well, and maybe how improvements can be incorporated in the future. When that's linked directly with line management, it can be directly aligned with performance evaluation and monitoring. So you can see how that might impact on the willingness of a new entrant to be completely honest and open about their concerns or queries they might have, especially if their confidence is already somewhat lacking. And that's really what underpins the recommendation that the person fulfilling the role of the preceptor, the person who's providing the one-to-one support to a preceptee, is not that individual's line manager wherever that's possible. In very small services, that's not always necessarily going to be achievable. If there's no realistic alternative, there needs to be some clear delineation between when the pair are having a preceptorship conversation and when they're having a line management conversation. That might be reflected in the ways that meetings are recorded and the way that concerns are discussed, but you can see that that's kind of going to be a slightly tricky thing to unpick. And then finally, there's foundation support. That might be language that's a bit unfamiliar to you. Essentially, foundation support follows on from preceptorship, and it involves a matrix or sort of an underpinning backdrop or foundation of opportunities for ongoing professional development and personal development across all four pillars of practice. And it also supports the development of a diverse workforce. So diverse in terms of the range of skills, experiences, and expertise that is developed within a team, and in terms of retaining and developing a demographically diverse workforce that reflects the diversity of the populations that we serve. As you'll have gathered, there's a degree of overlap between some of these concepts, but there's also some quite distinct differences. What they all look like together and how they're arranged in individual organisations and services will differ, and that's absolutely fine. There are no cast in stone rules, although there is some very clear guidance about what good practice looks like via the HCPC NHS England and BAPO guidance. And I hope that this sort of exploration illustrates how important it is to be really clear about what you mean and what your intentions are in relation to the support and development mechanisms that you offer to new graduates and more broadly to your staffing teams in general. I think a key point here is that traditional knowledge and skills-based graduate training schemes are not an automatic proxy for an individually tailored program of preceptorship. In the light of the profession's very alarming attrition rates, I hope that it's clear that there's a need to not only consider technical skills and breadth of knowledge of new graduates, but it's also really crucial to support them to successfully navigate what can be a tricky transition into their first registered role. That's how to enable them to become confident, engaged, skillful members of the team that you want them to be. And of course, the development opportunities that you offer staff aren't going to stop sharply at the end of a preceptorship program or a graduate training scheme. Supporting and actively encouraging ongoing professional development obviously contributes significantly to maintaining and enhancing the quality of services and the outcomes and the experiences of the patients. It's also a regulatory requirement of the HCPC. So the entry on the slide that follows foundation support might be another phrase that's somewhat less familiar to you. Enhanced practice is a level of professional practice rather than a role, and it sits between that entry to practice period described by preceptorship and foundation support periods and advanced level practice. So it's a level of practice that's occupied by experienced, knowledgeable healthcare professionals who manage a level of complexity and risk that's beyond what we would expect people to be managing as they enter practice at the beginning of their careers. So prosthetists, orthotists working at this level will typically have completed some post-registration education and training that's relevant to their area of practice and role. And I think that although the language might be new, enhanced level practice is something that you'll almost certainly recognise because it already exists within the profession. So at this level, clinicians are likely to be clinical leads. They might have responsibility for mentoring more junior staff. They're likely to have that expertise in managing the care of more complex clinical presentations and patient groups, and sometimes they'll be operating in specialist clinics. Okay, so let's bring the focus back to preceptorship. Having drawn some attention to what it is and importantly to what it's not, now I think it's a good time to revisit what we can reasonably expect of new graduates when they commence their first registrant role. So as the national regulator for the profession, the HCPC sets those threshold requirements for safe and effective practice to protect members of the public who are accessing services. And professionals must meet all of the standards of proficiency to register with the HCPC. At another level, the HCPC also approves pre-registration educational pathways associated with the professions that it regulates. So its standards of education and training mean that when pre-registration learners graduate, they're able to meet all of the threshold standards of proficiency for that profession. All of us who are on the HCPC register, me included, we're held up to these minimum requirements for our own profession. And every time we re-register with the HCPC, we declare that along with the standards for continuing professional development, we continue to meet these minimum requirements. As our careers progress, many of us are going to exceed these minimum requirements as a result of our ongoing professional development and growth and our experience and expertise that we develop over time. However, at the point of registration, it's the HCPC standards of proficiency for prosthetists, orthotists that sets out what we can reasonably expect of new graduates. After all, there's a limit to how much learning can be squeezed into any pre-registration program, and there's nothing that can replace experience in practice that's accrued over time. So what you can see here on the slide are the overarching, the main standards of proficiency for prosthetists and orthotists, which you'll know all have a number of different components within them. Obviously, we're not going to go through all of those standards during this session. So for illustrative purposes, I've just captured the details of standard 12 and the beginning of the details for standard 13. So the important thing about the HCPC standards is they're non-hierarchical, so they're all equally important to practice. And that includes all standards as they relate to the 4 pillars of practice. So those that are written in bold on the screen there are generic, and they appear in the standards of proficiency across all of the HCPC regulated professions. And those that are written in plain text are the profession-specific standards. The other reference point that's available to clarify what we can reasonably expect of graduate prosthetists, orthotists, is BAPO's own career development framework, which was published earlier in 2024. Level 5 in the Skills for Health Employability Skills Matrix represents those that are expected of new HCPC registrant prosthetists, orthotists. And you can see here how the summary of skills is mapped against the 4 pillars of practice. You'll find this information if you're looking at the career development framework on page 11, and there's the URL there, and again there's a QR code if you want to snap that to get hold of that document. Elsewhere in the career development framework on pages 17 and 18, you'll find mapping of the HCPC standards of proficiency against the 4 pillars of practice. So the ones that I've grabbed on the slide here are just the first 8. But all of this to say, really, that there are robust and established benchmarks that are available to you to guide what it's reasonable to expect from our new graduate prosthetists, orthotists who are joining your team. And that consideration needs to be given to supporting them across all 4 pillars of practice, not just the technical, the clinical and technical pillar. So there are also established principles and standards that guide what good quality preceptorship looks like. As we've said earlier, they're provided by the HCPC's Principles for Preceptorship, which was published in 2023, NHS England's Preceptorship Standards and Framework for the Allied Health Professions, which was also published in 2023, and by BAPO's own Early Career Guidance Framework, which, as we've said, was published earlier this year. And the BAPO framework brings together those core elements from the other documents, and it places them within the context of the P&O profession specifically. So what does that good quality preceptorship look like? Well, preceptorship should involve a partnership between the preceptor and the preceptee, and have input from the wider team and potentially from external professional networks as well, if that's appropriate. The partnership needs to include regular communication and review of a preceptee's progress, and an emphasis on joint goal setting. To have the desired impact, any preceptorship offer needs to be meaningful, and it needs to be of high quality, not a token gesture. It should be monitored and evaluated and reviewed, and where appropriate, revised at regular intervals. It should reliably identify those who need access to preceptorship. Depending on the size of your service, that might require more or less effort. If you're a small service, you know who your new starters are directly, and if they're new graduates, so that should be a little bit easier. But in larger organisations, that might need a little bit more coordination. It should support both uni and multi-professional learning and development. So that's to support the preceptee to build their networks and to appreciate the value of multi-professional working. As we indicated earlier, it might include the induction period if that's appropriate in your context, or it might follow on from an induction period. Preceptorship should be tailored to each individual preceptee, their role and their work environment. It should empower preceptees to reflect honestly on their individual strengths and their areas for improvement. It should empower them to identify and access the support that they need to develop their professional confidence. And it should allow them to influence the duration of their preceptorship in partnership with their preceptor, as well as the content of their preceptorship. So preceptors themselves, the people who are offering that one-to-one support and guidance, should have appropriate training, time and support to understand and fulfill their role effectively. So they should be acting as professional role models. They need to be able to facilitate access to multi-professional aspects of preceptorship where that's appropriate, to tap into their own networks, to support the preceptee to access those sorts of things and to develop their own multi-professional networks. They should be supporting reflection and sharing effective practice with their preceptee. To get the most out of a preceptorship program, it's best to try to develop something that is sufficiently flexible that it's going to support various types of transitions. So we're focusing at the moment on supporting new graduates as they enter the professional regulated workforce for the first time, but you might also be wanting to include internationally trained and experienced clinicians who are commencing their first UK-based role. You might also be wanting to provide some support for people who are re-entering the workforce after a long break. As we discussed in relation to what can reasonably be expected by graduates, a good preceptorship program will consider all four pillars of practice. So that's clinical and technical practice, education and facilitation of learning, leadership and management, and evidence research and development. That's going to support each individual preceptee to become a well-rounded practitioner in line with the expectations of the regulatory and the professional body. And there are some examples of what that might look like across the four pillars in the appendices of the BAPO Early Career Guidance Framework, if that might be a helpful thing to look at. As we've spoken about throughout this presentation, it's important to establish clear and individual goals to be achieved during the preceptorship program. And these need to acknowledge a preceptee's strengths, reflect their confidence levels as well, because strengths and confidence are two different things, and also to recognise and address the areas where they need support to develop. Encourage and make it possible for preceptees to shadow senior colleagues within the organisation or the clinic and potentially beyond that, so that they have the opportunity to learn from how more experienced practitioners work with different patient groups, and try to incorporate supportive observed practice to help ensure that the preceptee is working according to best practice and evidence-based guidelines. It's really helpful to allocate some protected CPD time to allow the preceptee to engage in other aspects of training and development and to take up other opportunities to further build their knowledge, experience, skills and their networks and so on. And where possible, if you're in a situation where there are a number of newly qualified staff and preceptees, it's really great to try to encourage a bit of peer support amongst those folk. And even those from different professional backgrounds. Again, that's part of the multi-professional networking. And it might even be appropriate to encourage some peer support across organisations. There's no harm in doing that if the opportunity arises. And finally, have a think about using a range of different approaches to try to keep track of and monitor a preceptee's progress towards meeting their agreed goals and objectives. So that can include a whole range of things: supervision, observed practice, case discussions and reports. You might allocate the preceptee the task of developing some departmental resources. You might be accessing feedback from colleagues or from patients and their families and carers. You might be asking the preceptee to complete some written or verbal reflections and some self-assessment. So there's a range of ways of keeping track of how people are progressing through their preceptorship. I think a robust preceptorship program brings benefits for the individual preceptee, for sure, but it also brings benefits in terms of staff recruitment, setting you up as an attractive employer who supports new graduates into the workplace, enabling them to integrate into the team, and that's going to support your retention and the development of the team. And that has a positive impact on the quality of the services and the outcomes and experiences of those people who are accessing your services. But don't just take my word from it. I'd like to leave you with the following thoughts. We all want the best possible outcomes for the patients that we work with, and investing in new graduates supports them to fulfill their potential and to contribute to that vision. It also supports recruitment, integration, retention, and development of your workforce. And that enables you to continue to enhance the quality of the services that you provide. But I'd also like to stress that it's not all or nothing. Okay, you don't need to go from a standing start if you have no preceptorship program at present to a gold standard preceptorship program before you even make a start. You know, I think that there's real merit in this lovely quote from Arthur Ashe. Start where you are, use and build on what you have, and do what you can. So start in whatever way you can reasonably begin the journey, and then learn and grow and develop from there. And also remember that you don't necessarily need to go it alone. Both Alistair and Finn highlighted that there are a range of resources that are out there and available to support in terms of templates and guidance and so on. But also, if you can, consider getting in touch with local Chief Allied Health Professions Officer or the local AHP faculty, and try to link in with local NHS preceptorship provision where you can. Sometimes that's simply a matter of having a conversation. Sometimes there's a little bit more involved, but there is work in progress currently from BAPO on another level about trying to make that a much easier system to tap into for everybody. And here on the slide, I've summarised the resources that we've referred to throughout the discussion. I'll draw your attention to the NHS England AHP Preceptorship Toolkit. You can just Google that and that will come up. It contains a whole range of resources that are specifically there for organisations to download and personalise to their individual context. So that is a fabulous resource. And the other thing that is useful that we haven't actually mentioned explicitly is the Broughton and Harris Principles of CPD and Lifelong Learning document, which is a really helpful one in terms of recognising and identifying individual registrant responsibility for their own ongoing professional development, but also thinking about how organisations can make it possible for staff to fulfil that obligation. And just as we move into some time for discussion and questions, I'd like to just drop this question into your thoughts, please. what resources would you like BAPO to consider developing to support you with embedding preceptorship within your service or organisation? But I'll stop sharing there, and we'll have an opportunity for a bit of discussion.
That's great. Thank you very much, Joe. That was a really interesting presentation. So we now have time for questions. So I'll ask you either if you want to write in the chat or raise your hand if you want to speak and ask Joe a question, please.
Can I add something, Joe?
Yes, absolutely, Alistair. And thank you for your contribution.
It's all right. It looks as though I was stuffed, but then again, that's fine. I think the slide that you had at the end about the BAPO resources, and I think one of the comments I made was about it is daunting doing anything like starting up clinical supervision or preceptorship, but actually getting some advice and help from people who already do it is invaluable. So even going through a mock program with an OT or a physio who's already involved in that can be invaluable in helping to find out sort of what questions to ask and how to guide discussions if you haven't done that sort of thing before. So actually, if BAPO, I know Nikki's on the call there, that actually having either champions who we could turn to for help with that, whether it is another AHP or actually running courses on how do you run a preceptorship course, I think would be really helpful.
Yep. Thank you, Alistair. And just to let other colleagues know, I have been having a number of conversations about preceptorship and about different people's ideas about what sorts of resources might be available. So I have got quite a list of possibilities that we are trying to prioritise over sort of successive years. But the idea of sort of preceptorship champions and training programs and that sort of thing is definitely on there. So noted, Alistair, thank you. Any other thoughts on the presentation or any other suggestions about what people think it might be helpful for BAPO to consider developing in terms of guidance and what have you? I'm feeling like either that means it's all crystal clear, which would be remarkable, or you're all just thinking, oh my gosh, Gary. Gary, did you want to come in?
Yeah. So basically, we're doing some preceptorship at Peacocks. I found linking them in with like the graduates in with each other and linking them in with the other students and apprentices actually works well, because it's that kind of nobody wants to ask a stupid question to somebody more senior. So they kind of not only, like you said about linking them in, it's not the line manager, or Finola said it on a video. So actually linking them in with, they might be around the country, but our graduates and apprentices and students all are in WhatsApp groups together, and then they come and go, we all kind of not sure about this. And
that's a lovely idea, because then nobody has to say, oh, it's me, I don't understand. We as a collective are not quite sure about something. And there's real merits in that peer support and peer learning as well. I think that's a really super idea. If other people got suggestions about how they manage their own preceptees or new starters or particularly new graduates. Just trying to see what's going on in the chat here. Does BAPO have anything written on competencies? No, but you're identifying, Nina, one of the things that we've recognised might be valuable to develop in the future is thinking about what kind of competencies might be most appropriate to focus on alongside the preceptorship program, and potentially following on from the preceptorship program in the foundation support period. So good question, not immediately available, Nina, but maybe at some stage in the future that will be something that comes up. Innocent, did you want to come in?
Hello, good evening.
Hi, good evening.
I'm just very excited to be here today, and thank you, Joe, and thank you, Dr. Nikki, for putting this together. So while I've been listening and following with some keen interest, most of the people who have spoken either from the perspective of employers and also senior prosthetics and orthotics, but I want to speak from the perspective of a recent graduate so that it will bring a balance to all that is being said. Sometimes this program, I can't tell you how much of benefit is going to help new graduate. I can't overstress it because from placement period to when we transit and onboard into new jobs, a lot of times you don't have the confidence. And also when you come to a place where the supportive structure is not in place, the people who you meet on ground will literally make you feel like you have wasted all your time in the uni. Some will even tell you to your face, I mean, what were you studying? You know, there have been things like that that brings people's confidence down. Some ask people question your degree, question, you know, and it's not a very good thing from the perspective of a new graduate. So it will really be interesting if, you know, employers and a lot of people are coming into this program to hear what preceptorship is and how people can be helped. For instance, apart from having been trained recently in Kiel as the first pioneer in Kiel University, I had trained abroad in Nigeria, but I came in here. I had to do, even though I didn't know I could get into HCPC with my degree, but I enjoyed the Q program. But it hasn't been much of, it has its positive and negative in terms of the placement. Sometimes you come back from placement, you feel like you don't want to go. You know, I remember one of the things my colleague said to me, unfortunately, she's not here today because she's passed on, but she wouldn't go back to an allocated placement because of what she was told at placement. The mom had to insist that she leaves the placements. This thing happened last year. Those are the kind of things you face.
Yeah, thank you, Innocent. That's it's really important that we hear the voices of recent graduates, and I think that, you know, it's really important that people feel welcomed into the profession, that they feel supported. I remember when I graduated, I'm not a prosthetist or an orthotist, I'm an occupational therapist. And I remember when I graduated, and that was a good many years ago, so it was obviously something that stuck in my mind. My confidence levels absolutely fell through the floor. You know, I was a good student, I was achieving good grades, but I was in an environment that I knew, that I understood, and then suddenly I'm outside in a completely different environment. The rules of the game are different, and you really have to work hard to navigate that transition. So the more support that we can give people, the more encouragement we can give people to build their confidence up again. As I said earlier, skills and confidence are not necessarily the same thing. And if somebody is underconfident, that can impact on the way that they present their skills. So, you know, let's all get into a space where we can support people to navigate what can be a very bumpy transition into their first registrant role, and then allow them to flourish and make really hugely valuable contributions to the team, to the service, and to the profession. Is there anybody else who'd like to? Sorry.
Yeah, I'm just saying that I'm so happy for what's happening here, because you know, I can't tell you all that, you know, all that I've heard have made me feel You know, sometimes
Okay.
you haven't even started the profession, but you're feeling like,
Yeah.
do you want to continue? Because of the kind of things you hear when they tell you at work, it reduces you, bring you
Yeah.
down because
Yeah.
that supportive environment is not there.
Yeah.
But I'm hoping it's
Thank
going to
you.
change what is happening.
We're working on it, Innocent. We're definitely working on it. Would anybody else like to add anything? I'm just looking in the chat.
There's a couple of comments in there.
Yeah. Shall I, Aoife, do you want to read those out, or I seem to have lost control of my mouse at the moment?
Just a thought, if BAPO could consider recent graduates, international practitioners in a different way, they might be better as international practitioners have other challenges when they
Yes.
come to work in the UK setting.
And totally. So that's the point about preceptorship being structured but flexible. And when you look at the HCPC guidance and you look at the NHS England standards and framework, international recruits are very much part of the target audience for preceptorship. At the moment, the work the BAPO is doing has a particular focus on new graduates, but we're not ignoring international recruits at all. And they do have very specific needs, and each international graduate will have very specific needs, just as each individual graduate will have specific needs. So that's why we need that flexibility built into things, and why it's an individualized program. It's not an off-the-shelf program that everybody just runs through the same thing. So that's the point about trying to keep a structured but flexible program as you develop something.
There was another point about, do you think there's a way for BAPO to facilitate a larger graduate network that can span across service providers?
That is certainly something that we could put on the to think about list. Absolutely. I think that you know, those networks being able to share notes and compare notes and go, phew, it's not just me then, because very often in your own head you're thinking it's just me, everybody else is fine, which undermines your confidence even further. So being able to compare notes with people who are in similar positions and go, okay, everybody's finding this a little bit challenging, it's not just me, we can pull together and we can get through this. I think that's a useful suggestion. Thank you.
Thank you for a very interesting talk. And then we have a question from Abby. Does BAPO have a document that clearly shows the progression of a P&O career to allow our graduates to see what they can be working towards?
Well, I think in part the career development framework kind of does that in a way. So it shows how skills and capabilities across the 4 pillars can develop. And I know that there is ongoing work to develop a number of case studies, a human library, if you like. I love the language of that, human library, where you can go and have a look at how different people's careers have unfolded and so on. Even in the back of the early career guidance framework, there are a couple of case studies in the back of that that illustrate how people have made decisions along the way, and just the different opportunities that have come up from time to time. I can see Nikki's got her hand up, so I'm thinking she's going to talk about case studies here at the moment. Then I'm going to come to Gary.
Thanks, Joe. I was going to say also the graphic that we're working on about how you can progress through each pillar. So we're working on that with Bev at the moment, and we'll put that into the career development guide as well when we finish this piece of work at the end of February. Just to quickly, the point about international recruits, which is really important. And at our Cardiff conference, Chiazoka did a presentation about her experience as an international recruit and the very specific things that she had to navigate. And I know she's part of our EDI group, and she was planning to do a support network for international recruits. She's on maternity leave at the moment, but I know she's going to pick that up when she comes back. So that's definitely in the pipeline as well.
Brilliant, thank you. And just as we go into the finish, Gary, did you want to come back in again?
Yeah, probably more for Nikki than for you, Joe. So, or both of you. So, as P&O is different to the other HPs in terms of we are a lot of our service is contracted service to companies. So when we try and do this preceptorship and so forth, it's kind of the NHS management of our services don't treat us the same way as say like the physios that are NHS employed or OTs. Our BAPO doing a lot of work on that with the higher up managements within the NHS to say, look, we are like, I work in a trust that does have a good connection, but then I do go into other trusts where they don't. So it's a kind of balance. Yeah. Sorry.
Yeah, I'll come in. I'll come in here, Joe. Yeah, we are, Gary, and we know that is a fundamental issue. So I did a presentation to the regional chief HPs about a week ago, and I pointed out this disparity between our contracted staff and our in-house staff. And I did this with Kay Pennell, who's working on contracting, and we posed quite a few questions to them. And I have to say, it was very positively received. And we now have another meeting in January. And one of the questions that we asked is, are you linking in with your contracted services, and are you ensuring that they have the same equity of access to preceptorship, to training, to progression opportunities, because they are seeing your patients, and regardless of who pays their wages, they are a part of the trust. And the answer was, we didn't know what we don't know what we don't know. And actually we were thinking, how can we connect with this group, but now we're going to go away and do that. So those conversations have started and they're ongoing, but that is a real fundamental issue and a disparity within the profession.
I think I'll just add to that and say the good news is there's a huge program of work that's going on within BAPO, and there's a lot of intersecting parts, and as they all come together, all of the pieces of the puzzle are going to join up and make a huge difference. Not going to make a huge difference by Friday lunchtime. You know, it's going to take a little while for these things to bed in and to reach their full potential, but there is a huge amount of work going on, and I, you know, even as an outsider, I'm really optimistic about the opportunities and the potential that has for the profession. Aoife, I think we're out of time now. I'm so grateful to everybody for being here and for sticking with us through this. And I really hope that it was a useful discussion for you. And please do go and check out those resources. And good luck with it.
Great. Thank you very much, Joe. And thanks everyone for attending and for engaging in the discussion.